Hello! Today's topic is managing jaw tension, which is something that many singers struggle with. Jaw tension has two general causes, the first of which is improper positioning of the jaw itself, and the second is what I refer to in my video on managing tongue tension as misdirected strength. That is, using greater muscular contraction or more muscular effort than is necessary and/or recruiting the wrong muscles or too many muscles for the given task. There are several jaw positions that can interfere with normal jaw function, cause pain and discomfort, and lead to resonance and vowel distortions, one of which is a forward jaw position. Many singers allow their jaws to slide forward, which can cause the jaw joint, the temporal mandibular joint, to pop out of its socket and the jaw to become unhinged. This habit of thrusting the jaw forward is seen very commonly in singers with hypernasally voices, in those who crane or turtle their heads forward in order to reach a microphone or a high note, and in those who sing with a really high larynx position. The jaw just sort of intuitively slides forward in order to accommodate or make more room for the elevated hyoid bone. If you're wondering if your jaw slides forward as you're singing, you can take your index finger and place it very gently against your chin and your nose, and this will allow some room for articulating your speech sounds and also for the jaw to move. And then you're going to watch yourself. If your jaw slides forward as you're singing, your hand is going to move along with it, which means that you're going to see that with your peripheral vision more readily than you would your actual chin. You can also use a mirror to monitor your jaw's behavior, but unless you have a three-way mirror, sometimes it's a little bit difficult to see what's really going on or to observe the actions of the jaw from the front. I don't ever recommend trying to force the jaw back into place using pressure from the hand, because all this is going to do is take these already hyperfunctional jaw muscles and encourage them to push even harder with even greater resistance against the pressure from the hand, which can lead to even more tension and possible injury. Additionally, it doesn't actually train the jaw to assume a better position or a better posture without external force being applied. Once the hand or the pressure from the hand is removed, the jaw will once again assume its habitual posture because that is what it knows, and that's what its neural pathways are telling it is normal and correct. Sometimes those who tend to thrust their jaws forward attempt to correct this faulty posture by forcing the jaw back. A common teaching that we often read in literature pertaining to classical singing is to wrap the jaw down and back in order to avoid jaw wagging and excessive jaw dropping, but some singers misunderstand this concept and they take it too far, forcing the chin into the neck. When they overcorrect like this, the jaw just becomes stiffer and immobile, as does the larynx. We also have to watch that we don't attempt to overcorrect a forward sliding jaw position by clenching, which is only going to lead to tension, especially of the masseter muscles, which are the main muscles that raise the jaw. A really useful way of retraining the jaw into a better position without compensatory muscle activation or external force is the use of gravity for assistance. Lie on your back on the floor. If necessary, place a couple soft magazines under your head for comfort and good alignment of the cervical spine, the neck, and allow gravity to position or collect the jaw effortlessly. Then vocalize from this position of optimal mechanical advantage. This will help the jaw learn new behaviors, to develop new neural pathways and muscle memory without the risk of overcompensating or replacing one tension in one muscle with tension in another. Another way of improperly positioning the jaw is forcing it too open. Those who've been instructed by their choir directors or singing teachers to maintain 2, 3, even 3.5 finger widths distance between the upper and lower incisors for projection tend to struggle considerably with jaw tension and pain. We have to bear in mind that everyone is built differently. For some singers, that large space between the teeth might be fine in terms of comfort and healthy jaw function, but for many it wouldn't be. Some singers do tend to hold their jaws too tightly and make too small an opening, and so they can learn to create a bit more space for their vowels, but that degree of opening should never be forced, and it should never be dictated by finger widths or corks or anything else that somebody might deem appropriate to place between the teeth. We also have to remember that the jaw opening differs from vowel to vowel and depends on the dynamics and the phonation frequency, the pitch. We tend to open our jaws more for vowels like ah, and also for louder singing and for higher pitches. Note that when I'm talking about jaw opening, I'm not necessarily talking about mouth opening. These are two separate things. They function somewhat independently from each other. Jaw opening is reflected in the distance between the two sets of teeth, the upper and lower sets of teeth, especially the molars. It's a good place to measure. And we can lower our jaws independently of our mouth opening. Obviously, it changes the shape of the mouth a little bit as we do that. We can also close our jaws and move the mouth into different shapes. I just love making silly faces for you guys. The second cause of jaw pain and dysfunction, misdirected strength, is often affected by or even caused by improper positioning of the jaw, which makes the jaw have to function from a less than optimal position, from a position of mechanical disadvantage. This in turn causes the muscles, and sometimes the wrong muscles, to have to compensate, and tensions tend to spread. When addressing and eliminating jaw tension, you'll first need to examine your general posture. Remember that if the body as a whole is not correctly aligned, the various parts of the structure will become stressed as they have to overwork. Secondly, you'll need to ensure that your jaw is properly aligned. That means making sure that it's not too forward, too back, or too open for your unique anatomical structure, for the vowel, the pitch, and the dynamics. If the jaw doesn't seem to want to get into a better, more comfortable position without a lot of effort, you may need to consider seeing a dentist or an orthodontist to check to see that your bite is normal. Some people have overbites and underbites that are not related to the teeth themselves, but to how the mandible and the skull have grown. Sometimes they grow at different rates, and these abnormal bites and misalignments need to be corrected, or else tensions and pain will never be relieved. If clenching or grinding your teeth at night or even during the day are what's causing your jaw tension, you may be fitted for a retainer or a night guard, which can help relieve the tension in those overworked masseter muscles. As the jaw lowers, it functions very much like a math compass. If you were to actually draw a line following the mandible's movement, you'd see that it arcs a bit on its way down. This is the healthiest and most natural action of the jaw joint. Keep that in mind when you're trying to keep your jaw wrapped down and back. As you release the jaw, it simply needs to be allowed to drop, rather than being forced backwards or downwards with muscular contraction. When it drops, and if it's kept in its hinges, it will arc down and back on its own. We just need to release the jaw. Practice doing so in front of a mirror. Let the jaw drop and hang somewhat loosely, but don't let it come out of its socket or its joint. We also need to train our jaw to function independently of the tongue when articulating our speech sounds. There is no need for us to jaw our diction by forcing the jaw rapidly open and close like we're dummies on a ventriloquist lap. La 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 la. In no way will this improve diction. All this is going to do is distort our vowels and cause the jaw muscles to have to overwork. It doesn't represent good economy of movement. So you have to learn how to move the tongue up and down for rapid consonant formation without simultaneously moving the jaw. In most cases, during the singing of consonants, we should position our jaws in preparation for the vowels that follow them. This will not only economize movement, but it's also going to reduce the transitional sounds that tend to muddy resonance and diction. We also have to train the jaw to function independently of our lips when forming vowels, rounded vowels and consonants such as oo, w, b, and p, as well as any other consonants that assume this rounded lip shape in anticipation of the vowels that follow them. For example, in the word move, we tend to set our lips into the oo shape during the production of the In doing so, we want to make sure that the mandible doesn't slide forward when the lips protrude. Only those jaw movements that are absolutely necessary for the formation of the speech sound should be encouraged. But this does not suggest that we don't allow for any flexibility of the jaw. When our jaws become stiff and tense, we can also massage the masseter muscles, which again are the main muscles that are responsible for raising the jaw. If we clench our teeth really, really firmly, we'll feel these muscles pop out. So when massaging, we can simply lower the jaw, allow it to kind of hang loosely, and begin to massage in circular motions using our fingertips. You can even do this while you're vocalizing, while you're singing scales or vocal phrases. A, B, C, D, E, F, G, H, I, J, K, L, M, N, O, P. And what this will do is it will keep the jaw muscles, those masseter muscles, from locking. Raspberries, the kind in which the tongue tip flutters against the lower lip and the airstream passes between the lower lip and the bottom of the tongue, may also be useful in helping us to find a comfortably loose but not too loose jaw posture. The cheeks also tend to flutter, which means that your facial muscles are quite relaxed as you perform these. Just watch that the jaw doesn't slide forward. And the bonus here is that they come with a lot of spit completely free of charge. I hope that this video has helped you understand and maybe even diagnose some of the possible causes of your persistent jaw tension and give you some strategies for relieving it and ultimately preventing it from returning. Thanks so much for watching, and I will see you next time.